The services at Clarevue, initially you have to be identified, and in doing that you just can't walk up and say we have a mental case client. First, there are things that has to be eliminated because it might be a medical condition creating the problem.
At Clarevue Psychiatric Hospital, we attend to clients with bipolar disorder, we have schizophrenia, we see patients with anxiety, depression, and also sleeping disorder to a lesser extent. We at Clarevue, we only attend to adults.
So family members may observe their member is not going on, their family member is not behaving as they should, forgetting, being untidy, doing different things that is not in sync with their daily routine. There's when the family support comes into play, and that observation is made. You can reach out to your district nurse, your nurse in the community, your doctor in the community, and you're guided accordingly. That is when they will do their workup, refer you to Celeste Byrne, and then the initial medical assessment is done. When there's no underlying factor, then is when you're referred to the Clarevue Psychiatric Hospital, and the management takes place there.
Mental health does carry a stigma. Lots of persons doesn't like to be exposed to the public when it relates to mental health. But what you find is that there's not much of a choice when you become mentally ill and need to be institutionalized, because we cannot have you out there. The police involvement comes in when relatives need assistance with getting these individuals to a hospital because they're aggressive, they're violent, untidy. There are so many things along with them. If they're to be admitted, it is the police that go to get, because they're admitted by a court order. And it's the police that would go to get the court order to ensure that they're being admitted after they're being assessed by the psychiatrists and other doctors at the hospital. Persons really don't have much of an alternative to go, because that is where you can get your attention and be able to return to normal functioning and back to your society.
We have an outpatient community that we service, and that is done on an average. It's approximately 75 persons monthly that we cover and ensure that they have their ongoing medication, even outpatient medication, all supplied by the medical benefit schemes. We cater for a daily walk-through clientele, which caters approximately on an average between 30 to 35 persons within a week that walks in and comes in to our organization to accommodate their medication. And there's always the accommodation for the new client that has to be addressed and dealt with. In addition to that, we provide the service on a community level for ongoing clients via the clinics. It also incorporates Barbuda. Our doctors go out to the communities. They're in contact with a doctor on land in Barbuda and the public health nurse, and basically we have a collaboration from the base at Clarevue Psychiatric Hospital. In addition to the services we offer the psychiatric management by the medical team. MBS infiltrates our overall care to the client in many ways. I can list a few. On a daily basis, the overall basically medication supply, whether it be injectables, orals, are supply that we have to tally and titrate for the needs of the client, and requests from you all comes from MBS. We have what we call like the body care supplies, in that overall the persons with challenges with the pamper supplies, the padding, the things to basically make them confident in their day-to-day routine via Celeste Byrne Medical Center, in that when we have our clients with some investigations, routine investigations, the thyroid, the PSAs, whatever, yes, we channel it through Celeste Bird, but the funding for all of that and the agents and the supplies and the chemical aspect is MBS. You are where you come from. And if you are aware certain things exist in your family line, I would say don't set it up to be stigmatized. Address it. Deal with it. Something is not right. You notice a sibling, an aunt, or uncle not behaving, and you're aware somebody along the line had challenges. Reach out and don't be afraid to give the history, your medical history and family history. And I think that's where we need to nip that stigmatization in the bud. Prevention is the key. And I would tell anyone, substance abuse and addiction is not a simple task, because you make one step in and you realize you're further down the road than when you look back the distance. And getting back to your original stance is not an easy task. And it may strip you of your total dignity and who you are. And that's not a sacrifice anyone should be prepared to make. I would implore folks, basically always assign some time for yourself. I would consider that me time. At some point in time in the day, basically start with a little 15 minutes to basically sit and absorb yourself and relax. It does do a lot for you and your peace of mind. In addition to that, point some time on your day off for you. You may not have the money to spend. We have lovely beaches here. You can take some time, do a little walk-out, even once a week, 3 times a week. Personally, my advice, 3 days a week I go walking, and it does help. It relaxes you overall and gives you a new, fresh start to take what is thrown at you. Occupational therapy area in the ground, because when you have an in-house client that is being prepped to go back out in community, you need a routine, and that occupational therapy area is where that support comes in, and our social worker guides you and ensure that the level of interaction and you normalizing you to get back into society and take part. Here I would like to ask organizations within our community, private partners, to assist in supporting us to ensure the activities on the ground for our clients, that even the outpatients that do come and take part in some of the occupational therapy items, that we can get that support. You can get in touch with us, the administrative management, via the superintendent, via the medical team, and you can basically ask to see them, let them know of your ideas and how you're willing to support, and we'll be willing for whatever you want to donate to us. Thank you.